Hello, I'm Dr. Omar Bey, and this is A Moment in Medicine. Our focus is health, education, and wellness. Our goal is for each and every one of us that have that opportunity to grow old in good health. Welcome to our show. Tonight I'd like to start off with caring and sharing. And what we mean by that is that telling our story. Each of us has a story of medicine, of illness, of a time that we had to overcome that particular illness. And telling our story, what we can do, we can help someone else overcome their medical illness. It just may help. Go to www.medmoments.com. That's www.medmoments.com. Email me. Let me know what's going on out there. Let me know your med moments. We have a great show for you tonight, and the topic is going to be obesity. Obesity is a problem that we're finding throughout the U.S., and as physicians, we come in contact with that each and every day. I have an excellent guest here, Dr. Cynthia Page, and she's a family physician. Dr. Page is in private practice, and she is director of Cypress Health Institute. And I would like to introduce Dr. Cynthia Page. Welcome, Dr. Page, to our show.
Thank you, Dr. Bey. It's a pleasure to be here with you.
All right, thank you. I thank you for coming because this topic is so important to all of us. Now, the first thing I always like to start with as far as the topic is concerned is, what is obesity? Tell me what it is.
Well, obesity is the second leading cause of death in the United States. So it's a major problem after tobacco smoking. And the challenge is most people don't know what obesity is and whether or not they're obese. The diagnosis is made by using a calculation that compares the height with the weight. That calculation gives us the body mass index. And the body mass index over 30 means that you're obese. And most of my patients come in and they may have that diagnosis and don't know that they have the diagnosis. My challenge is to let them know that this diagnosis is there, and then we have to work on that diagnosis.
All right. Now just tell me a typical patient that comes into your office. Now, most of the patients, do they come in and say, hey, guess what, I'm overweight, I gotta lose weight, help me out, doc? Or from your point of view, you have to actually introduce the subject to most of the patients?
I think most people know when they're overweight. I think most people do not know when they're obese because they haven't had that calculation done. Many people come in asking for help with weight loss, and other people come in not really thinking about weight loss, but then we find diseases such as diabetes, pre-diabetes, hypertension, and all of the other comorbidities or these diseases that come along with diabetes.
Right.
And my challenge then is to help them to get rid of those diseases, and typically the first step is weight loss.
Okay. Now, you said something that I want to clarify because it kind of shook me up a little bit there. You said overweight and obese. Is there a difference?
There is a difference. So overweight is a body mass index, or BMI, over 25. You would not know that unless you go online. There are numerous sites online. If you just type in body mass index, you can typically find a site that tells you to put in your height and weight, and it will tell you your BMI. It calculates that for you. Okay. Anything over 25 to 29.99 is overweight. Obesity is over 30. Severe obesity is when that BMI is over 40.
Okay, all right then. So let's just look at it this way. If I'm overweight, do I have to worry about diabetes, high blood pressure, heart problems, and all the other things that they say are associated with weight changes or increased weight?
It depends on your genetics. So some people can develop things such as diabetes at a normal weight. Others, typically you're overweight or obese before that happens, but it really just depends on your genetics.
Okay.
I have some people who are severely obese, but they don't have diabetes, they don't have hypertension, they don't have high cholesterol. Everything, all of their other numbers are fine. But for most of us, as we start to become overweight and obese, that's when we start to see all of those other very, very common diseases appear in our charts.
Okay, so you said another nice word there, genetics. I like that word. What does it mean in a sense that, does it mean that if mom had high blood pressure or mom was obese, then the likelihood because her genes are my genes that I'm going to be there, I'm going to have the same problem as well?
It increases your risk. For certain diseases, your genetics almost directly are predetermined by your family and what happened with mom, what happened with dad, and what happens with your diseases. But for things like obesity, we know that there's a social component to it. So we know that there's a socioeconomic component. So in lower income brackets, we know that there's a higher amount of obesity. We also know that if there are a lot of supermarkets in your area, then you have access to lots of different foods, and so therefore your obesity rates may be lower. If the streets in your neighborhood are safe for you to walk, then obesity may be lower. If there's a bike lane, then it may actually encourage you to get out and bike. Obesity may be lower in those communities. So we do know that there's a social economic component to obesity as well as a genetic component.
Okay. Now you just put out something, exercise. It seems, and you were referring to that, but you didn't quite say it. Exercise must be a big issue as far as being overweight or obese.
It really is. And movement, and it doesn't have to be exercise. It can be just activity. So mopping the floor, vacuuming the floor, going up and down the stairs, that's physical activity, that's burning calories. Exercise is the best way to maintain your weight loss once you have weight loss. The best way to actually lose weight is changing your diet.
Right. Now, I know so many of my patients come in, and being a physician, of course, I talk about overweight as well. So many patients come in and talk about, Doc, I just can't exercise. I can't do it. Is there other things that they may be able to do to supplement the exercise aspect of it?
Absolutely. And again, diet is the best way to lose weight. And so I can easily, in about less than 5 minutes, consume 1,000 calories.
Okay.
I can go out and have a cheeseburger with some fries and a shake, or even, it doesn't even have to be a shake, maybe a juice, and consume 1,000 calories in 5 minutes.
Okay.
It would take me about 2 hours of exercise to burn off 1,000 calories. So the challenge is that you can't consume calories that you can't burn off so quickly. So the key really is looking at your diet, and it's not just calories. In our practice, we talk a lot about carbohydrates and the components of the foods that you eat when you're really trying to lose weight.
Okay, so let's break it down. Since we've introduced diet, you said carbohydrates. That's a big word.
Yes, it is.
All righty.
And I don't know what a carbohydrate looks like.
Me neither. No.
I know.
I'm gonna have to look that one up. What does it look like? No,
That's
I'm just kidding. But
we know where to find carbohydrates,
Right,
and
true,
that's
true.
what we really talk about. Is
All right.
where are the carbohydrates? Carbohydrates are compounds that break down into sugar in your blood.
Right.
So they raise the blood sugar. In addition to that, they raise your body's insulin level, and it makes it harder for you to lose weight. And so I'm a huge proponent of reducing the carbohydrates. If you can reduce the carbohydrates, many times you're also reducing the calories.
Okay.
So that's what we do a lot.
Now, when you talk about carbohydrates, we're talking, because it's important, and I understand dieting and I understand diets. When you talk about carbohydrates, you're talking about potatoes, pasta, bread, rice, all the things that I just love to eat.
Yes.
How do I handle this?
Well-
I mean, it's right in front of me. It's like, give me a break.
They're the easiest things to eat. Many times they are the cheapest things to eat as well. So a diet that's healthy and one that will help you lose weight is usually a little bit more expensive. So carbohydrates are found not only in your starches, so they're in your bread, rice, pasta, and potatoes, that's your starches. But carbohydrates are also in your vegetables in a much lower amount. And so a bowl of rice, doesn't matter whether it's black, green, blue, or purple, it's 45 grams of carbohydrates. versus a whole plate full of broccoli, string beans. There you might get up to 10 grams of carbohydrates in a whole plateful versus 1 cup of starch.
Right.
And then your fruits also have some carbohydrates as well. They're a little bit higher than vegetables. So we give out a chart that, because you can't learn it in 15 minutes, so we give out a chart that explains where the carbohydrates are and what your goal is for weight loss. How many carbohydrates can you consume, as well as if you have diabetes or pre-diabetes, which is where I like to catch it. So I like to catch disease before it actually becomes disease, so that primary prevention of disease. And so we talk a lot about carbohydrates and understanding your foods.
Okay. How do we well, put it this way. Each person is a certain weight. And obviously they burn a certain amount of calories. Now, on an average, how many calories should an adult take in a day? Should it be 1,000 calories? Should it be 3,000, 5,000? What's a normal? What I shouldn't say normal. What is excuse me. What is the normal, or for that particular person, if it's a female or if it's a male? Give me an idea of what a normal should be.
It really varies. It depends on your size. It depends on whether you're trying to maintain weight, gain weight, lose weight. It depends on your activity level. Typically for the average female, it may be anywhere from 15 to 1,800 calories per day.
Right.
To lose weight, we will typically drop a woman down to about 1,200 calories per day, maybe 1,000. And then once you get under that, that's what we call a very low calorie diet.
Right. Not
so safe if it's not monitored. And then for men, it's typically, we're talking about a 2,000 calorie, 1,800 calories per day.
Right. All right then. Now, I understand that taking in calories, if you burn those calories up, be it exercise, be it that you have a metabolism that will burn it up. Metabolism, that's another word. I understand that you won't gain that weight. But tell me about, there are certain patients I know that come into the office that can't burn up the calories. They can eat maybe 1,500, 1,000 calories, and they still gain weight. What's with those patients? Tell me about that.
It depends on your what we call your basal metabolic rate.
Right.
As we get older, and so for women, as women get into their 40s,
just hold up. Basal metabolic rate.
So that's how many calories you will burn sitting still all day.
Gotcha. All right.
If you do nothing but sit still, how many calories will you burn?
All right. Now I didn't want to break, so you can continue.
And that rate drops down as you go into your 40s. Your ability to burn calories sitting still decreases. So therefore, you might eat the same as you've eaten all your life, but you find that you're gaining weight. And that's because your body does not require so many calories. Once a woman goes through menopause, her need for calories drops about 300 calories per day. And therefore, if she does everything the same, she will gain weight. So she either has to exercise more to increase that metabolic rate, so the rate that your body burns calories, or she has to decrease her caloric intake by 300 calories, meaning that she just can't eat as much, or maybe she has to drop off a glass of juice. So a glass of juice may have 300 calories in it. And so she may have to decrease her caloric intake.
Oh, all right. Now, you're talking about women. What about us guys?
Men, same thing happens. What we call that andropause. So women have menopause and men have andropause. As men approach that time where the testosterone level goes down, the other thing that happens as well is the metabolic rate decreases. And so men will start to gain weight as well in their 40s and 50s. Same process.
Okay, all right. Let's talk about disease entities or other diseases that may be associated with obesity. Because
just about every organ in your body is affected by obesity. And whether it is your heart, your joints, so we know that osteoarthritis, it also increases your risk for certain cancers. So it increases the risk for breast cancer, uterine cancer, and probably some what we call genital urinary cancers of the kidney and bladder area. So we know that it affects every part of your body. You as a pulmonologist, you know that when we start to see the neck size increasing in men especially, but in women as well, that the risk of sleep apnea, obstructive sleep disorders, just difficulty breathing. There really is virtually no part of the body that's not affected by carrying too much weight.
Okay, all right. Now, I know that dieting is one aspect that's very important. Exercise is another aspect that's important as far as helping you maintain or lose weight. I understand that there are procedures that some patients may undergo that may help them lose weight as well. Mm-hmm. Can you just touch that just a moment?
Absolutely. I'm not a big fan of dieting. I am a fan of changing the way you eat for life. Mm-hmm. And if people are having great difficulty in doing that, or they can't exercise and they are significantly overweight, typically we talk about a BMI over 35, definitely a BMI over 40, then we begin to talk about surgical treatments for obesity. Those surgical treatments are numerous at this point. So we have gastric bypass, gastric band, gastric sleeve, and for the most part, they will reduce your weight by about 15% at 5 years. So when we look at someone and I'm counseling someone about weight loss, then I let them know that, okay, you can lose, if you're looking at losing 50% of your excess body weight, you have to be able to figure out how overweight are you. Mm-hmm. So if you are 100 pounds overweight, certain therapies will reduce your weight by 50 pounds. Others may get up to 80 pounds and you're looking at about 2 years maybe losing 80 pounds. Okay. But in order to keep all of that weight off, there still has to be a commitment to diet and exercise. Okay. And so I have numerous patients who are going back for a second surgical treatment because the first one they lost weight, they gained it all back, maybe plus additional pounds. Or they felt that they did not lose enough weight, and so then they're looking at a second surgical procedure. So surgery is not the total treatment. There still must be that commitment to diet and exercise so that you look good, you feel good, and you are healthy all around.
So you're saying that there's a big psychosocial component to it.
And emotional.
And emotional as well.
Absolutely.
Mm-hmm. Because I know that I as well have patients, and I always call it the nibbling syndrome. You can nibble your way back to obesity.
Yes.
And if you have this surgery, it decreases the pouch size, so it's very difficult for you to take a large meal, but you truly can nibble yourself back. It's not how much you eat, it's what you eat.
Absolutely.
A candy bar has quite a few calories.
Yes, it does. Yes, it does.
There's another aspect of obesity I'd like to touch on. Children and teenagers in this country. It's a tremendous problem. Can you just? I don't treat children, so it's out of my realms. Could you? And I know you're family medicine, so I know it does come in your realm. Could you tell us a little bit about? Because I would think this would be a real challenge.
It is a challenge, and it helps to be the family physician because I'm managing. Typically, when I'm managing childhood obesity, I'm managing the parents' obesity as well. Okay. And so there has to be a shift in the way the family eats, the way the family exercises, the way the family watches television. And we talk a lot about not crippling children with obesity. And we as a nation are in trouble because we cannot afford the diseases that will come along with obesity in children and obesity in adolescents.
Right.
And so we have children who are obese, but when you look at their parents were not obese at that age. The parents may have become obese, but now we have children who are obese, and we know that people typically gain weight as they get older. So as you go into from your 20s to your 30s to your 40s to your 50s, we know that people are steadily gaining weight. So when you're starting off as obese, then you're ending up as super obese, severe or super morbid obesity. And so as a country, we're in economic trouble, and as people, we have children and young people who are just going to have the burden of disease, not only the ones we talked about, but also the depression. There's an increased risk of suicide. And so we talk a lot in our practice about how do we change what's in the refrigerator, change what's in the cupboards, and change the way we eat, where we eat. Do you eat in front of the television? Do you eat at the kitchen table? Are you allowing people to eat in their bedrooms? Those types of things must change in order to combat childhood obesity.
Okay. So what you're saying is that, I can see the problem with that. be it? Because there's so many single family homes, children that are having other difficulties, and eating just may be a way that they solve, they comfort themselves, if you understand what I'm saying. So it's difficult for me to understand or to really grab how we convince the young that this is the way to go. You know what I mean? That obesity is not what they should be doing. I gather you see this more than I, as I stated in the past, but it's just difficult for me to grab that, if you understand. I think that it's just something that we as physicians, or put it this way, I as a physician have a problem with, and in talking with their parents, and sometimes the children come with them, and I really try to associate just like you, you know.
The other challenge, Dr. Bay, is that we have to help people to understand their food. And to understand that what you see on television that is portrayed as healthy is not necessarily healthy. So, you know, how do you get the juice out of the refrigerator? Put more water in the refrigerator so you decrease the consumption of calories that way. How do you have fewer foods that come in boxes, bags, and containers, and more fresh foods? And that's really a shift. And again, it's more expensive, though, to do that. But that's really the shift that we must make. And people have to have that commitment to not wanting their child to be crippled by their weight.
Right. Now, you talked about different end organs that were associated with obesity. When you talk about coronary artery disease or heart disease, and are you truly talking about patients have an increased chance of heart attack because of obesity?
Yes.
Yes.
Obesity increases your risk for heart disease. The fat, especially if the fat is in the midsection, so what we call truncal obesity, where the belly gets really big, especially in women. So women should have a distribution of fat where most of the fat comes in the hips, the buttocks, the thighs.
Right.
Men, typically when they gain weight, it's in the midsection. So if you have a woman with a large abdomen, her risk of obesity, her risk of diabetes and comorbidities such as breast cancer, uterine cancer, go up because of that truncal obesity. We know that it leads to inflammation and lots of other problems. And so it's the distribution of fat as well, and that distribution of fat in the midsection increases the risk for heart disease and diabetes.
All right then, all righty. I know that I'm associated with it because of the obstructive sleep apnea. And what I mean by that is that I have an obese person, usually 250, 300 pounds, come in and sit down. And that's not uncommon, and talk to me about actually having apnea. And apnea is when you actually stop breathing at nighttime because your neck, you don't only gain weight on the outside, you gain weight on the inside, so it gets very narrow. So it's so important for these people to lose weight because of the apnea and the other illnesses that can come about because of the overweight.
Absolutely.
Dr. Page, it's been wonderful talking to you about this particular subject. Obesity, I know it's something that you see in your office often, and I see that you truly have a handle on it, and I know your patients are doing well.
They are.
We're going to have to get you back to discuss another topic, and I'm just so happy that you were able to take some time off from your busy practice and come and talk to us today. Thank you very much.
Thank you, Dr. Bay. It's my pleasure.
At this particular time, I'd like to have a segment of let's talk just for a minute. I was reading over something today, and I just want to go over some tips as far as mammograms, okay? Mammograms are so important for females, and it's a procedure, I should say, that helps us prevent breast cancer. And I just want to go over a few tips. Each patient, who is a female obviously, should have a mammogram if you're over 40 years of age. And truly, you should try to have a yearly mammogram as your age goes up. You should go to a center that you feel comfortable with, but also go to a center that specializes in that particular procedure. They should do that procedure all the time, not a center that does it once in a while, but a center that's really used to doing the procedure and that you're comfortable with having it done at that particular center. The third thing is that you should try to go to the same center each time, because they will have your last mammogram that they can compare this one to, so that they can make sure that the mammogram is normal. As far as payment is concerned, Medicare as well as Medicaid and private health insurances do pay for your mammogram at these outpatient centers and at hospital centers. Remember, deodorants as well as creams and as well as creams can inhibit the reading of the mammogram. So try not to wear these on that day. And also note that the mammogram only takes about 20 minutes to do. So allow yourself at least that time when you go to the center. And also make sure that you get your results from your mammogram. If you have not heard from the center or your private physician after you've taken the mammogram, make sure you contact them to get your results. This is so important, and mammogram is something that's necessary for all females, as I stated, over 40 years old. I'd like to also, there was a email that I got, and I'd like to also address a PSA. PSA is prostate specific antigen. And basically I got an email and someone asked me that they had a positive prostate specific antigen from their physician, and they hadn't had a chance to talk to their physician yet, but they wanted to know whether that meant that there's a possibility that they may have prostate cancer. I got to give you an answer of yes, that is a possibility. You must see your physician, you must follow up with this result, and don't take too much time going to your physician. Make the appointment as soon as possible. Go check up on that result. In closing, I'd like to talk about caring and sharing one more time. Remember, we all have med moments. And med moments are those times in our lives that we may have had chest pain or shortness of breath that made us aware that we should take better care of ourselves. Let us know about your med moments, and in letting us know, we can let others know, and it just may stimulate someone else to go see their doctor. Remember, www.medmoments.com. That's the website. Go and email me. Alrighty. Number 1, never institute any change in your medical therapy until you consult your physician. I trust that each and every one of you have continued good health. I'm Dr. Omar Bey, and this is A Moment in Medicine. Until next time, I'd like to say peace to you all.